Hello, everyone. I'm Dr. Marty Ross. I guess we're in a webinar from sunny, balmy Seattle tonight. So I've got my Hawaiian gear on for that. Actually, it's in the mid-70s right now, but it's supposed to go up to 95 this weekend, which is unheard of in these parts. So I'm prepared for it. Good to be with you here tonight. This is a webinar where we talk about Lyme disease. And you create the webinar with your questions. So I'm interested in seeing what you have in store for me tonight and for all of us. If you are new here, I'm glad to see that you're here. And I hope that you get some useful information that will help you with your treatment. And then for those of you who are back again, I'm glad to see there's a number of familiar names that I'm seeing on the message board tonight. And I suspect that means you're getting some value out of this. So I'm glad that I'm able to help you with some of the issues that you have. I am creating a recording of tonight's webinar. And so tomorrow morning, somewhere around 9 to 9:30 a.m. Seattle time, you'll get an email from me announcing that the recording is ready. And so look for that in your email. In that email, also, there'll be a sign-up link for the next series of webinars that will begin in a couple weeks. So I take next week off. So I usually try to do 3 of these in a row and then take 1 week off. So next week I will not be with you doing a webinar, but the week after I'll be back again. So in tomorrow's email, you'll be able to sign up for the next series of webinars. And then for those of you that are here on the live version of the webinar, because many people listen into the recorded version, but in the live version, you'll be able to see the questions. I do post them on the screen so you can read them, but I am going to actually read them out loud so that people that are participating in the recorded version can actually hear what the question is about too, okay? So I think that pretty much answers everything. Well, we go ahead and get started here. Oh, one other thing. When you're to write questions to me, there's a chat box over on the right-hand side of the screen. If you are writing questions to me, I ask that you try to keep it short. Long questions don't work out in this format. And if they're really too long, I wind up just not dealing with them because they could potentially jam my computer screen, believe it or not. So anyhow, just be aware of that, okay? And so let's go ahead and get started. I'll take our first question here. Hi, Lawrence. Let's see. Hi, Dr. Ross. 2 questions for you. Number 1, my LLMD has prescribed Welchol to treat my mold issues, but I've also been taking GI Detox as well. Is it okay to take pharmaceutical and natural binders together at the same time? So let me answer that first. Welchol, everyone, is a pill form of medicine similar to cholestyramine, actually. So it's a medicine that we can use that was originally designed to treat high cholesterol levels. And the way it works is it binds cholesterol in the intestines. When somebody has a buildup of mold toxins in them, we try to remove them by binding some of the ones that work their way into the intestines to pull them out. And Welchol can work well for that. There's also a binder called GI Detox. That's a natural medicine supplement. It's got some humic acid, fulvic acid, zeolite clay, and charcoal in it, and some silica. And these are all substances that can bind mold toxins too. GI Detox is known as a broad spectrum binder because it can bind a variety of mold toxins like black mold, aflatoxin, gliotoxin, et cetera. I mean, just a whole group of them. So the problem with Welchol and cholestyramine, which is similar to, is they tend to lead to constipation, all right? The natural binders, like a GI Detox, tend not to. It is possible to use both of these together. The GI Detox may have a better chance of picking up a broader range of toxins and binding them than what the Welchol does, and they'll have added effects together. Even though the GI Detox does not tend to lead to constipation, if you start getting constipation, you may need to decrease the GI Detox so you can keep taking the Welchol, okay? And you ought to let your provider know you're doing this too so that they understand what you're doing as well, okay? All right, let's see. Number 2, I was prescribed Minocycline for my Lyme recently, but haven't started it yet because I am concerned about aggravating my tinnitus. How likely is it to aggravate tinnitus? And how bad is it if I were to discontinue Minocycline after a few days or a couple weeks if it worsens the tinnitus? Also, any sense of how much sun sensitivity is caused by minocycline? will I need to be put on sunblock every time I go outside when on this medication? All right. So minocycline, everyone, is a tetracycline. And so there are 3 kinds of tetracyclines available. I think it's still only 3 that are available here in the States. That is tetracycline is one, minocycline is another one, and doxycycline is the third. Of the 3, minocycline tends to be more fat soluble and may concentrate in fatty tissues around the brain that cover our nerves and sometimes can become an irritant to those nerves, okay? All right. So can it cause tinnitus? Yeah, it can, but have I seen it happen? No. I use a lot of minocycline in my practice, and even though theoretically it can, I have not seen it lead to tinnitus, okay? So I think it's an extremely, extremely low risk of it. If you were to get tinnitus, I just want to make you aware that because it is a fat-soluble medicine and kind of loads itself up in fatty tissues that cover the nerves, things that get into the fat can take a while to get out. And so when you stop a minocycline, trying to reverse side effects of it that are due to the irritation of the nerves, it can sometimes take 2 weeks to 4 weeks for some of those symptoms to go away, okay? And then let's see, in terms of minocycline and sun sensitivity, of the tetracyclines, minocycline tends to have the least chance of causing sun sensitivity. And in some people, they don't have any sun sensitivity at all on it, okay? And so the only way to find out is try it and see, do you burn easily on it or not? You may find that you don't need to do sunscreens on it, but you'll have to kind of try by trial and error. If you are going to go out and try it without sunscreens, I suggest using a half hour or an hour at a time. I wouldn't go out much longer until you see if it does create a sunburn for you or not, okay? There is sometimes what I will do, because minocycline tends not to give sunburns, is I sometimes will lower the doxycycline that I have a person on and add a little minocycline in. And that seems to prevent the doxycycline sunburns as well too, okay? All right, and then let's see here. Yeah, anyhow, I think I answered your questions there. Good luck to you, Lawrence. Hello. Oops. No, I was trying to post one there. Let's try that again. There we go. Hello, Dominic. Let's see. Hello, Dr. Ross. Excuse me, everyone. All right. Sorry about that. Say hello, Dr. Ross. Question regarding Thorn Meriva 500 curcumin. Can I take it with all antibiotics? Is it better to take it with food or without? How many capsules should I take a day? How long does it take for me to see results? Can you drink alcohol? Thank you. All right. So everyone, Meriva 500 is a Thorn product, and it is a liposomal variety of curcumin. And liposomal means it is a curcumin that's microscopically wrapped in fat to increase its absorption into the bloodstream. So curcumin is a component of the seasoning turmeric, and it is useful at lowering inflammation cytokines. Cytokines are chemicals made by your white blood cells when they see Lyme and mold toxins. And in Lyme and mold toxin illness, they sometimes get made in excess. And it's the cytokines that give you most of your symptoms of what we call Lyme disease and even mold toxicity illness. When you have a Herxheimer reaction, which is as you start killing germs, the immune system sees the dead germ parts and reacts by making more cytokines. And so you can see a flare in cytokine symptoms like fatigue, brain fog, body pain, insomnia. All those things can get worse as part of a Herxheimer reaction, because in a Herxheimer reaction, you get an overproduction of cytokines, okay? So curcumin in the Meriva 500 is one of my favorite things to use to control cytokines, limit Herxheimer reactions, and start to lower those cytokines. And you want to lower those cytokines for a few reasons. Number one, can sometimes help you feel better, even though while you're killing the germs. Okay. Number two, it helps limit the Herxheimer reaction. And number three, if you have excess cytokines, as most people do in Lyme, that those excess cytokines suppress your immune system. So one of the ways that you can help your immune system start working better is to do things to lower the cytokines, of which curcumin is one of the main ways to do it. I usually advise people take 500 milligrams, one pill 3 times a day. And for more severe cases of excess cytokines or for bad Herxheimer reactions, you can actually increase that to 1,000 milligrams 3 times a day. You can take it in the real world. I have people take it, meaning how I use it in my practice, Marty's real world. I have people take it as with or without food and with or without antibiotics. To me, it doesn't matter. It's going to work either way, basically. In terms of taking it with alcohol, I have no problem people taking it with alcohol. Yeah, I think I just answered your questions there. All right. Good luck to you, Dominic. Actually, let me just do a quick screen share. I want to show you a couple things. All right, let's see here. Okay, so this is my Lyme disease information site, which is Treat Lyme by Marty Ross MD. And in terms of trying to get information, if you're ever wanting to learn something about Lyme or have a question, I've arranged everything I've written into these various topic categories. Okay, so you could search by a topic category, or you can actually write up here in this search box whatever it is that you want to get information about. Okay, but in terms of cytokines, just to give you guys more information, there's a whole article I've written about cytokines, what they are, and what you can do to lower them, of which the information about the Meriva 500 is in here. The curcumin, okay. And then, let's see here. So I've even written an article about curcumin. And this is the article here, just viewed, it's under curcumin. You can write the word curcumin up there and you'll find the information that I've written about it as well too, okay? Let's see. There we go. All right, Jim. Thanks for that question. Actually, I'm sorry, not Jim. Jim's my next person here. Let's see here. So I'm going to post a question from Jim. Hi, Jim. Let's see. Thanks for all your great work. My Arabinose number on my oat is 16. The reference range is less than 20. Is that good, bad, or so-so? Should I treat yeast at that number? The Great Plains lab also says the marker 3-oxygluteric indicates a possible yeast overgrowth in the GI tract. Is this the marker at all useful? Also, is XMRV something a person with Lyme should be concerned about? Thanks. All right. So, so let me explain what this test is, Jim, so that everyone is on the same page, and then I'll answer your specific question. So, there is a test you can do, which is known as an organic acid test, or it's an OAT. And this test looks at various organic acids that are found in your blood. You can do a more limited profile called a microbial organic acid test, which measures just organic acids that are made by germs, okay? But the whole OAT panel, which includes more information beyond just germs, includes the microbial organic acid test. So, so with yeast overgrowth in the intestines, one of the things we run into is there's not 100% accurate way with a lab test of knowing if you do have yeast or not. So if we were to do, for instance, you could check and see if you have too many yeast growing in your intestines by doing a stool test, and where you send stool to a lab and they try to see if there's extra yeast in there. What I have found in my experience, most of us find in our experience, is that the amount that grows in a lab test like that seems not to really correspond with the degree of yeast problems a person might have. Okay, so it's not an accurate way of seeing if you have yeast overgrowth, because yeast overgrowth really is a relative thing for each person. All right. Second way that we can, and sometimes you can be loaded with yeast symptomatically and actually have nothing show up when you try to culture it or you look for it under the microscope. So that doesn't seem to be an accurate way. Another way that people tend to try to treat for yeast or test for yeast is some doctors will measure antibody levels to see if you're making high levels of IgG antibodies against yeast. The trouble is, some of us may just make antibodies against yeast because they live in our intestines anyhow, and we may make antibodies against them. And just finding antibodies does not tell us, do you have too many yeast, okay? All right. So a lot of us have been trying to figure out, well, how do we figure this out? So there's two ways that I try to approach yeast. Number one, when I'm trying to figure out if somebody has too many yeast, what I have found to be the most reliable way of looking for it is to do a yeast questionnaire that looks at risk and symptoms of too many yeast in the intestines. And if you score high enough on that questionnaire of 140 or more, then I find that there's a good chance that treating for too many yeast will make a difference for a person, all right? So there's a yeast screening tool, and I'll show that to you here in a minute, all right? I have found that to actually be more reliable than any kind of testing, even the oat testing, okay? But if I am wanting to get some laboratory evidence, I will do this oat test, and I have found of the various organic acids, the test that is the best indicator for too many yeast is the Arabinose test. And there are other markers that they sometimes report beyond the Arabinose, but I don't find them to be reliable for yeast. The only one I really find reliable, is the Arabinose. And I find it reliable if it's elevated. But if it's not meaning if it is elevated, you definitely got too many yeast, and I find benefit from treating. But even the Arabinose test is not perfect and sometimes can miss yeast if you have it, okay? So the number that you have on the Arabinose, I think you said 16 is good. I don't think that test says you have yeast, okay? But I still would you should consider looking at how you score on the yeast screening questionnaire I have. And if you score high enough, then you may want to treat, high enough being 140 or higher, you might want to treat for too many intestinal yeast, all right? All right. Let's see, your last question is XMRV. So XMRV is a virus that kind of gained a lot of interest maybe, I think 5 or 6 years ago. It might even be longer. I've been at this too long, but I think maybe 5 or 6 years ago, gosh, it may even be longer than that. This was a virus that I think Dr. Judy Miskovitz had done some science showing that there may be a relationship between it as a cause of chronic fatigue syndrome, okay? And to be honest, I think that even though there was a lot of attention on it back then, I think most of us found that it probably in the working with patients, that it probably was not relevant and that doing something about it did not make a difference. So most of us don't bother looking at it or trying anything for it, to be honest with you, okay? Yeah, so let me just do a quick screen share here for you. Okay, so let's see back here again. All right, so take a look for information about yeast and how to treat it and how to diagnose it. Take a look at my yeast chapter here, okay? And so you can find this article here, A Silent Problem is at Yeast, where I kind of walk through how do you make the diagnosis. And in here is a link to my questionnaire. Let's see, where is that? Here it is, right here in the middle of the page. Yeast screening questionnaire, okay? If you score 140 or higher of it, then that is an indication you could have too many yeast going on, okay? And then in terms of what do you do if you have too many yeast, take a look at this guide here, my Kills Yeast Guide, where I lay out both the prescription and herbal options to lower the yeast load down, okay? All right, thanks for the question. Hello, Nancy. Hi, I so appreciate the wonderful consult I had with you several weeks ago. You're welcome. To refresh your memory, I am at the end of my BART treatment and doing about 90% better, but my T-Labs test shows Bartonella and lots of biofilms in spite of being on many biofilm busters. We talked about herbal options, which included liposomal oregano oil with clove and cinnamon. I worked up to one twice a day, but it made me nauseous. even threw up a few times. I tried to stick with it for several weeks to see if this would pass, but the gut symptoms seem to intensify. I have stopped it and my gut is back to normal. What else might you suggest I take instead of the liposomal oil, I think is what you mean by loo? Besides my supplements, Baluki, I'm taking Hutania, Lauracidin, and Alamed for my antimicrobials. Thank you. So Nancy, before you give up totally on the liposomal, oregano, clove, and cinnamon oil, I have a suggestion for you to try first, okay? So everyone, so with Barton, and so Nancy, I can only disclose what she said here. I can't tell you more about her besides what she did because of patient confidentiality, but I'll talk about the things that she laid out here, okay? So first of all, the T-Lab is a newer microscopic exam where you can see if there is Bartonella in your blood, okay? And I'm still not 100% clear about the reliability on that and how useful it is clinically because it's a new test. But it on her T-Lab microscope exam, there was evidence of having Bartonella. All right, so that's what she's talking about there. And then in terms of what do we use to get rid of the things that could be blocking a Bartonella treatment, and this is the process I have to go through. So if I have somebody that comes to see me, as I often do, people that have Bartonella that have not gotten well on previous treatments, what I want to do is look at, number one, did they do an adequate treatment? Did they take things that should have gotten rid of the Bartonella? Did they take enough of them? Okay, meaning antibiotics, either herbal or prescription, okay? Second thing, I'm always going to want to make sure when I treat them again is to make sure we're doing something to break up slime layer, biofilm layers that can cover the germ and keep antibiotics and the immune system out, all right? So we now know, based on research that was published over a year ago out of Johns Hopkins University, that Bartonella has biofilms, and that I believe the Hopkins study that got published over a year ago was the first study to actually show that, okay? The other thing we learned from this Hopkins study that got published in December of '99 is Bartonella actually has persister forms, and we did not know that before. And so we need to design a treatment that will deal with persisters too. So what are persisters? Well, some of you may be familiar with persisters because that's something we're now figuring out Lyme has too. So both Lyme and Bartonella have a growth phase where the germ is growing a lot, okay? And the growing Lyme and Bartonella is what we traditionally have been treating when we use prescription antibiotics. Prescription antibiotics are great at treating growing forms of Lyme and of Bartonella. But we know that both Lyme and Bartonella can be hard to get rid of in a certain section of people. And so there's been research going on trying to figure out why. 5 years ago, Northeastern University in Boston did some studies where they will show on lab experiments that one of the reasons Lyme may be hard to treat is it can develop persister cells. And now we know from research that got published out of Johns Hopkins in 2019 that we now know that Bartonella can form persisters too. All right, so what are persisters? So again, persister is a way of describing a growth state of the germ. So these germs have growing forms, and then there's about maybe 5%, 10% of these germs, when they're exposed to antibiotics, can go into hibernation, where they slow their metabolism way, way down. And when they do that, they ignore the standard antibiotics we throw at them. Okay, those are called persisters. And so there's been a lot of work going on now trying to figure out what are we going to do. So on the Lyme side, we learned that disulfiram, a drug that we use to treat alcoholics, can be useful against persisters. And we also know from research by Dr. Horowitz out in New York State that dapsone is another drug that can have some benefit on persisters. But there are also our herbal options. And some of those herbal options are coming to us out of Johns Hopkins University studies and Dr. Ying Zhang's lab. So for instance, cat's claw has been shown to be effective against persister Lyme, and it treats growing Lyme. Cryptolepis, which is something we traditionally use, an herb we traditionally use to treat Babesia, now looks like it might kill growing Lyme and help with persister Lyme. Okay, that was a study that was published, I think, maybe 3 or 4 months ago now. And it was, again, one of Dr. Ying Zhang's lab's experiments that showed that, all right? But the other thing that has been shown to be useful especially for Bartonella, is doing essential oils of cinnamon, clove, and oregano are essential oils that can do two things. Number one, they break apart biofilms. Remember, I said biofilms are one of those things that can block a treatment. And also, they treat the persister forms of Bartonella. And in addition, they treat the growing forms of Bartonella according to the laboratory experiments, okay? I will also tell you that the Hopkins studies suggest that these herbs are also useful against growing Lyme and also persister Lyme too, okay? So with Nancy, one of the things that I had wanted to address with her treatment was that we had her on things to deal with growing, but also persister forms and to get rid of biofilm, all right? So back to your specific question then, Nancy. So the trouble with essential oils like cinnamon, clove, and oregano is that sometimes they can be kind of caustic to the stomach, and not that they're actually damaging tissue, but they can really irritate your stomach because they have a burning quality to them, okay? So, Nancy, what I have found useful in about 50 to 60% of people that have a lot of nausea and upset stomach on these pills is to try something called deglycerated licorice. So licorice is not the candy kind, not the black licorice or the red licorice, but actually herbal medicine tablets of licorice, all right? And if you chew licorice, saliva interacts with chemicals in the licorice, resulting in a microscopic gelatinous coat. And that coat can actually cover your stomach and protect it so it's not irritated. So about 60% of the time that I have people having trouble with the liposomal essential oils like this, I'll have them chew licorice tablets about 5 to 10 minutes before they swallow the liposomal oil. And often that's going to be enough. That'll take care of it, okay? So a product that I like to use that has this deglycerated licorice in it is a product made by Integrative Therapeutics, which is called Rhizonate. And you would chew 2 tablets of that probably about 5 to 15 minutes, well, maybe 5 to 10 minutes before you wind up taking your essential oil and see if you can tolerate it, okay? All right, that would be the first step. Now, maybe you tried that already. Maybe we talked about it. I can't remember. I think you can appreciate I talk with a lot of people each day. But if I didn't suggest that to you already and you hadn't discovered it through some of my webinar material, give that a try first. If that doesn't work, then you may be left having to consider doing a prescription option to deal with the biofilm and to deal with the persisters. And that option is to use something called methylene blue. And so the Johns Hopkins experiments showed that methylene blue can also break up biofilm, and methylene blue can also treat persister forms of Lyme and even Bartonella too. All right. So what's methylene blue? Well, methylene blue, everyone, is a prescription. And so it's something that was actually designed to treat a blood hemoglobin problem that we have repurposed because we have found that it actually can treat persisters. And so for this blood hemoglobin problem is something called methemoglobinemia, where the hemoglobin protein in the middle of your red blood cells that carries oxygen doesn't let it go. So your tissues become starved of oxygen because the hemoglobin won't let go, won't release the oxygen in the tissues. And when people are in a crisis with this, if we do intravenous methylene blue, it bumps the oxygen off of the hemoglobin, and suddenly people are getting enough oxygen to their tissues, okay? But because it's manufactured and only made in an IV form, the way you get it is we have to have a compounding pharmacist mix it up into an oral form. And there's a few companies in the country that are doing it. It's a really messy substance to work with. So most compounding pharmacies do not want to touch it. But the 3 that I have found is there's a PD Labs pharmacy down in just outside of Austin, Texas, and Cedar Park, Texas does it. InfuServe down in Florida does it. And then Hopkinton Compounding Pharmacy in Hopkinton, Massachusetts will do it too. And I usually have people take 50 milligrams twice a day of that. It's a bit more of a spendy option than doing the essential oils that I just mentioned here, okay? All right. Good luck to you, Nancy. So everyone, if you're wondering where you're going to get these essential oils, let me just show you, do a quick screen share here. Okay, so number one, in terms of treating Bartonella and this approach I mentioned of treating for growing and persister forms and biofilms, if you want to see what I've written about that, take a look at the infection treatment plan section here. And take a look at this article called Kills Bartonella, a Brief Guide. And in here I describe methylene blue and the essential oils that I've just been talking about too, okay? Actually, this article, I think I may only mention the oregano here, but I'm now I use oregano by itself, but sometimes I also am working more with oregano oil, cinnamon, and clove, because that also works well too. And I actually need to alter this article to include that as an option. All right, so then in terms of the oils, if you want to know a source for that, because they're hard to find, this is my supplement store that my patients get things from, but anyone, even people that aren't members of my practice can buy things from here. And so take a look for this. What I would do is take a look under my supplements mega menu here, look under the brand called Doctor Inspired Formulations. And I carry both liposomal cinnamon, clove, and oregano essentials, and just the pure oregano essentials, okay? And so take a look. This is the product we were just talking about, okay? All right. All right, and then let me go back here. Okay, and then Nancy, one other idea I just thought about for you too. The other thing that you could do before you even switch over to methylene blue would be to just try the liposomal oregano oil product that I just showed you there. Sometimes it is less by itself without the cinnamon clove. It's going to be less irritating to the stomach too. The amount of that Doctor Inspired Formulations brand that I was just showing you, the amount of oregano is the same between the two products. So the amount of oregano that they put in their liposomal oregano product is equal to the amount of oregano they put in their liposomal cinnamon clove oregano product, okay? So you may not have as much irritation in just the oregano oil capsule by itself too, all right? And then again, I meant to show you the licorice, but the product is called Rhizinate. That's Rhizinate. Actually, I'll just show it to you real quick so you know what I'm talking about. All right, so Rhizinate. And actually, Integrative Therapeutics has a sugar-free product as well as one that has sugar, but this is the products I was telling you about, okay? All right, good luck to you, Nancy. Hello, Alex. Hi, Dr. Ross. Seems like I'm having a flare-up of one of the bugs. Was diagnosed with Lyme, Bartonella, Babesia, and Borrelia 2 years ago. Recently been, so just so everyone knows, Lyme and Borrelia are the same thing, okay? All right, Borrelia is Lyme, and then Bartonella and Babesia are what we would call the co-infections, okay? Let's see, recently been feeling very fatigued, chest pain, elbow pain, not sleeping well. Which one of the bugs do you think is flaring up? Also, I'm concerned if I take the COVID vaccine next week, I will get a double whammy of a cytokine storm and feel a lot worse. Should I wait until I start treatment and feel better to get the vaccine, or get the vaccine now? Thanks. All right, so I'll give you some things to think about with the vaccine. Ultimately, I can't tell you what to do because I'm not your physician, okay? But I can give you some things to think about, all right? In terms of your decline, I can't tell from what you've written here as to what germ it may be, but let me describe the process I go through when people come in similar situations. So it's very common that people come back to, or not very common, but when a person comes back to see me and they think they have relapsed, it is very common in those situations that about 80 to 90% of the time, it's not a true relapse. What it is they've developed yeast overgrowth in the intestines. And you may be thinking, what the heck does that have to do with getting symptoms back that look like Lyme and Bartonella and Babesia? Well, remember, when you have Lyme disease, the reason you feel badly is your immune system overreacting and making too many cytokines, right? And those excess cytokines give you fatigue, give you brain fog, make you hurt all over, give you pain, and even make it so you don't sleep well, okay? All right. So the most common reason, especially after somebody's been on antibiotics, prescription for sure, and even sometimes herbal antibiotics, keep in mind those herbal and prescription antibiotics, even when you're off of them, while you're on them, they cause a disruption in the good bacteria in your intestines. And even 3 and 4 years out from being on those antibiotics, you can still have disturbed balance of good bacteria in your intestines, and that can lead to allowing yeast to grow too much in the intestines. And if yeast grow too much in the intestines, guess what they trigger? Cytokines, okay? So they create a situation that looks just like Lyme disease. So if I were to see you in office, I would be starting to ask things about what your diet's been like. Have you had a lot of sugary substance in it that might have been feeding yeast all of a sudden? All right. And then I would also be wanting to know, do you have a lot of symptoms that look like yeast? So are things that make me think of yeast. So number one, be asking if you have a lot of sugar cravings. I'd be asking, are you having a lot of intestinal gasiness or bloating? Have there been any changes in getting like looser stools in your diarrhea or having diarrhea? Okay. I would want to know, are you having difficulty swallowing? Sometimes we even get yeast up on our food pipe, and it can make it feel like things are catching. And then sometimes when people have too many yeast, they're going to develop more pimples and acne. And what the relationship is there is too many yeast in your intestines release toxins that get absorbed into your bloodstream, and those toxins interact with the skin if you have a genetic predisposition, leading to pimples and acne, okay? All right. And then if you're a woman, I'm going to want to know if you have been having recent trouble with vaginal yeast infection, either discharges or itching. But there are times that even when somebody comes to see me that I'm still not clear if they have yeast or not. Sometimes I'll just put them on a yeast treatment, and about 80, what my experience tells me is about 80 to 90% of major declines after you've been doing well and you were treated for Lyme and co-infections, 80 to 90% of the time, it's due to a yeast flare-up in your intestines. Okay? All right. All right. Now, in terms of the what to do with your vaccine, I'm not sure what the best way is for you, but here's your things to consider. Number one, if you do, given that you are flared up right now, you're having too many cytokines. Either it's Lyme co-infections or yeast that's triggering it, okay? And even if you start getting treated for those, they're probably going to still stay flared up for a little bit. So you know, and then if you get the vaccine, the vaccine itself triggers more cytokines. All right, but if you get COVID, it triggers more cytokines too. And if you get COVID, you may have a bad outcome from that too. So I'm not sure what the best way is for you. I probably would I would want to have a bigger conversation with you so I understood the depth of how bad you are. If it's super severe and you are my patient with how you're feeling right now, I might be inclined to say, wait a week or two while we start doing some things to get your germs under control. Whatever those germs are, okay? But again, I don't get to ask you all that. So I don't know the best way for you to go on that, okay? All right. Good luck to you, Alex. Hello, Leslie. Let's say Dr. Ross. Hold on here just a minute. Let's see. Hi, Dr. Ross. I started Banderol and Cemento almost a year ago, adding 1 drop every 5 days or so. I am just now at 30 drops 2 times a day. With each drop, I experienced a pain flare that lasted 2 to 3 days that I let subside to pre-treatment levels before adding another. So far, I have not experienced relief. How long would you administer the full dose before changing approach? And when you consider the flare with each drop to be encouragement that the herbs are killing your germs? Thanks for these webinars and all the information you share. So let me see if I understand this. So it's been a year you've been on this. Okay. So let me give you some things to think about. So everyone, first of all, Banderol and Cemento are herbal antibiotics. Banderol is otoba bark. That's the generic herb in Banderol. And cat's claw is the generic herb in the Cemento. Okay. The company that makes these products is called Nutramedics. And these are pretty good. They're good products. So Banderol and Cemento, or actually generically otoba and cat's claw, I find to be effective in helping people about 85 to 90% of the time. So I use them in my practice fairly often. I give them the same chance of helping a person as I do any 2 prescription antibiotics I might put you on. They, according to laboratory experiments, they do a great job of killing the 2 forms of Lyme that lives in us. And by forms, I mean what the germ looks like. There's the spirochete that looks like a corkscrew. There's a microscopic cyst form of the germ. It can kill both of those, okay? The cat's claw, more recently, that's in it, has been shown to treat both the growing phase of spirochetes and growing phase of cyst and kill the persister cyst and persister spirochetes as well, too. So this may help with persisters as well. And then finally, laboratory experiments show that the Banderol Cemento in combination do just a wonderful job getting rid of biofilm, all right? So pretty good treatment in terms of the things that it can do. There are some people, though, that get pretty significant Herxheimer reactions. And, on the surface, it looks like you may be getting a Herxheimer reaction each time you increase. The only thing I'm concerned about here is that you've been on this for a year and you're not seeing any improvement yet. I think if I were working with you as my patient, I would probably consider staying at the 30 drops 2 times a day for perhaps about 3 more months and see if you're getting any improvement. Because one of the reasons you may not have been seeing any improvement yet is from herxing each time that you go up, all right? But also, though, at this point, usually you've been on it long enough, even at lower doses, I would expect you might be seeing some improvements already, too. So I would say give it about 3 more months and see. That's kind of how I would handle this in my practice, all right? And then let me describe one other thing to consider. So when we treat Lyme and we treat Babesia and we treat Bartonella, of those 3 germs, about 80 to 85% of the time, Bartonella will take about 4 to 6 months to get over, okay? Babesia is going to take about 4 or 5 months to get over. On the other hand, Lyme can take a good 1 to 2 years to improve. But one of the studies that's been done looking at Lyme treatment was an unpublished study that was presented at the International Lyme Associated Diseases Society meeting probably about 10 years ago now or more. And in the study, people that had Lyme, and they only had Lyme, not co-infections, were put on clarithromycin, which is Biaxin, and Flagyl, just those 2 antibiotics. And those 2 antibiotics will treat spirochete and will treat the cyst form of the germ, okay? And they were watched to see what would happen. And so what that experiment showed is that by 3 months of treatment, only 30% of people started having improvements. By 6 months of treatment, 60% of people started having improvements. And by 9 months of treatment, 90% of people started having improvements, okay? So that would suggest that even at 9 months, 10% of people on something that should be working hadn't responded yet. So the reason I say that to you, Leslie, is to let you know that sometimes you may not even see anything. You'd be in a small group, but you just may not have seen anything yet because you haven't done it long enough, okay? And then there's one other study I want to share with you, and that is the My Lyme Data, which is a project being run by LymeDisease.org in California, where they basically have enrolled 15,000 people, and they collect questionnaire information on them. About, I think, a year ago now, did a study where they looked to see what did it take for people to recover. And what that study showed is that the best chance for recovery was using antibiotics. They did not, I think in that study, they were talking about prescription antibiotics. They didn't break out herbal antibiotics. So I don't know whether herbal antibiotics would have the same chance of success here or not. But what the study showed is that of all the things that people tried, including ozone, hydrogen peroxide, stem cells, you name it, the thing that had the best chance of helping was antibiotics. And it took, on average, a year to 2 years for people to recover. Okay, so Lyme takes time, and it just maybe you haven't, because you were still working up on your dose over this last year, it may just be you need to give this 3 more months to see if it's going to work for you or not. Okay, all right, those are some thoughts for you. All right, good luck to you. Hello, Bridget. Let's see. Good afternoon, Dr. Ross. I really appreciate this question and answer webinar. I'm great. I hope you're getting some benefit from it. Let's see. Last week, I was diagnosed with chronic Lyme disease, which my naturopath believes I may have had for up to 6 years. It was in December of 2019 that it became fully debilitating and I was unable to work. My blood test confirmed the presence of American and European strains. I rated very high on the Lyme Immunoblot IgG test, 4 out of 6 positive bands, 7 out of 11 positive bands, respectively. The Lyme multiplex PCR serum and whole blood test did not detect the presence of Borrelia burgdorferi, but from IGenex's website, I read that this test looks only for this species and not other species. My IGenex spot test was greater or equal to 3. My question is whether I should get the COVID vaccination before or during treatment, which hasn't started yet, or not at all. I held back getting the vaccination because my health was poor and I didn't know how I would cope with the vaccination. I have never received any flu vaccination, so I think there's a second part to your question here. Let me see if I can find it. No. Well, Bridget, I can't find the second part to your question, so I'll try to answer what we have there, okay? Okay. So let me make a few comments here. So Bridget has laid out a number of tests that we can do for Lyme. The Immunoblot, which is the one that came back positive, is a test that IGenex developed a few years ago now that I think has become kind of the gold standard at diagnosing Lyme. And it's a method, the Immunoblot is a method they use to see if you're making antibodies against 8 different strains of Lyme, which includes both some of the American versions and European versions. A lot of those European versions have now worked their way across the water to our side of the pond, if you will. So it's looking to see if you have antibodies against proteins found in these 8 different kinds of Lyme germs. In addition, when the testing is done, one of the things that makes it a really good test is that one of the risks we have in doing antibody testing against Lyme is, and measuring whether you have antibodies stuck on Lyme proteins, is sometimes the antibodies stuck on those Lyme proteins were actually made against a virus infection, and they happen to just cross-react to parts of the Lyme proteins. In other words, they could give you a false positive test. Okay. So what IGenex has done is they've taken these proteins and they genetically modify them to remove the pieces that would hold on to virus antibodies. So when you get a test back positive on this IGenex Immunoblot, the chances of being false positive is extremely small to non-existent, basically. Okay. And because they're testing to see if you have antibodies against 8 kinds of Lyme, they have a good ability to find it. And so the test, based on their own validation studies, will detect Lyme when it's there 95% of the time. And when it comes back positive, is correct 100% of the time. It's a pretty good test, okay? PCR testing, on the other hand, is a technique we use to see if you have the DNA of the Lyme germ in you. And one of the problems with DNA testing in Lyme is that Lyme doesn't readily live in the blood. So you can go stick a needle in somebody's arm and pull back the blood. And if there isn't any Lyme swimming by that needle right then it just means it's not going to show up. So The effectiveness of PCR testing at finding Lyme is only 30%. All right. So not finding it on a PCR doesn't mean it's not there. All right. And then finally, this IGenex spot IGenex spot is another method to detect Lyme, which uses a technique called an elispot technique. And what we do with an elispot technique is we're measuring to see, we're trying to see if a type of white blood cell in your body called a T cell has ever tried to attack the Lyme germ. All right. Now, your T cells only live in you for 2 months. And so when it comes back positive, it's looking to see, it answers the question, in the last 2 months, have they tried to attack the Lyme germ? All right. Now, in terms of its accuracy, it all depends on the lab. So there's a lab in Germany called Armin Labs that does an elispot test. And they claim, based on data that they show, that it works about 85% of the time. All right. So it will miss it 15% of the time. Now, it's hard to say because Armin actually has been using a test kit manufactured by another company. It's not even Armin's test. And they say based on data out there that it should be 85% effective. They've never tested it themselves, though. All right. IGenex, on the other hand, with their IGenex spot test, did do validation studies, but their validation studies actually don't look good. The ones I saw, I think from 2 years ago, showed it only finds Lyme when it's there about 40% of the time. Okay, so given that, your best test is the Immunoblot, and that's what you did. Okay, all right. Now, in terms of getting the vaccine, so when you have Lyme, the reason you feel badly is you got too many cytokines in you. I already mentioned that tonight, but just to summarize it again. When your immune system sees Lyme infections in you, it's going to react. White blood cells are going to make cytokines. And those cytokines' purpose is they're supposed to turn the immune system on. So they're supposed to cause more white blood cells to be made, help those white blood cells work better, and bring the white blood cells, draw them, attract them to where the infection is. Okay, that's great. But if the immune system isn't doing a good job, it's going to try harder and harder, and eventually it's going to make too many cytokines. And too many cytokines give you fatigue, make your brain not work, make you hurt all over, disturb hormonal functions, disturb sleep, etc. Okay, it gives you what we call Lyme symptoms. All right. Now, what else can trigger cytokines? Well, yeast, too many yeast in you can, too many mold toxins in you can, and getting COVID can. So if you were to get COVID, not the vaccine, but if you were to get the infection, it would trigger cytokines too. And regrettably, we know there still is a lot of COVID out there, especially depending on where you live in the country. And we are also seeing that if people get COVID, sometimes they are really struggling with post-COVID syndrome to recover, all right? So in your consideration, you have to weigh out risk and benefits. There is a risk in not getting immunized against the COVID vaccine and getting COVID. And COVID in a person with Lyme is not a pretty picture, unfortunately, okay? All right. On the other hand, you have a risk when you get the COVID vaccine of the vaccine triggering more cytokines. And for most people with Lyme, that triggered increased cytokines only has a worsening effect for maybe up to about a few days to a week. All right. So anyone, whether they have Lyme or don't have Lyme, that gets the COVID vaccine, the majority of people are having cytokine excess symptoms that occur around the same, about a day or so after the shot through a few days. And that means that the COVID vaccine may make you achy, feel flu-like, give you fatigue, give you brain fog. Okay, those are cytokine symptoms caused by the COVID vaccine. The same chance of that happening and the same length of that happening appears to be the same in somebody that has Lyme and somebody who doesn't have Lyme. So can you expect, if you get the COVID vaccine, to be knocked down for a little bit? Yeah. Do you have any increased chance compared to the average person who gets a COVID vaccine of getting knocked down more than them? No. And that, I say that based on research that was published by LymeDisease.org. I mentioned them earlier tonight. They have this project called My Lyme Data, and they queried people with Lyme maybe about 2 months ago and developed a study and looked at how do people with Lyme handle the vaccine. And what the results were is the same as people that don't have Lyme, okay? So could you get knocked down? Yeah. Could you get knocked down temporarily? Yeah. Is it going to become a permanent knockdown? Probably not, because the average person with Lyme without Lyme doesn't get a permanent knockdown from the COVID vaccine. All right. So I can't tell you what to do, but I can tell you that I can give you these things to consider. It's a matter of weighing out risk and benefits. All right. So is there a lot of risk of getting COVID? Depends on where you live. If you live in an area where people have only gotten 25%, like in some parts of rural America where they're only getting 25% of people vaccinated, you're at a big risk of getting COVID. If your neighbors had behaved better for the sake of the community and you gotten vaccine, then you wouldn't have to worry about it. Okay. If you're in Seattle, where 70% of us decided to get vaccinated to help ourselves and our neighbors, you'd probably be okay not getting the vaccine, because we've reached some degree of a community-wide herd immunity here, okay? But if you live in an area where people have not decided to take care of their neighbors by getting vaccinated, well, you may be at more risk and you may need to go ahead and get the vaccine yourself, okay? So you have to weigh out risk and benefits there, okay? All right, so those are some things to think about. I can't tell you whether to get it or not. You should ultimately discuss it over with your doctor. But I think if there's a great chance of getting it, depending on where you live, if there aren't enough people that got vaccinated, I would err on the side of getting the vaccine. And I want you to know that generally people with Lyme have been tolerating the vaccine fine. They tolerate it the same way that anyone else does. Okay? All right. Good luck to you, Bridget. Hello, Tammy. Let's see. Thank you, as always, for hosting this webinar. You're welcome. What is the maximum dosage of quercetin that you recommend for an adolescent with food and environmental allergies and asthma? Also, is it more effective if the quercetin is combined with the bioflavonoid? I noticed that the Thorne brand on your website has phytosome, but not bioflavonoids. Is one more important than the other? All right. So quercetin is a bioflavonoid. I just want you to know that it's classified as a bioflavonoid. Luteolin is another thing that can help limit histamines found in asthma and allergies. That also is a bioflavonoid, okay? So quercetin, everyone, is a substance that comes from vegetables. Primarily, a good source of it is onions, actually, all right? And it is useful for a few things. Number one, it interrupts and interferes with enzymes used to create cytokines. I already talked about cytokines a number of times tonight. So quercetin is a kinase inhibitor. It blocks enzymes called kinases that lead to cytokine production or aid in cytokine production. But historically, what most of us have used quercetin for is that it's also known as a mast cell stabilizer. So inside mast cells are where histamines are made. And when you're allergic to something, so if you're allergic to something, that thing lands on these mast cells, releases histamines, all right? Other things that cause histamines to release mast cells is having chronic infection seems to turn them on, and they more easily release histamines too. But what quercetin does is it stabilizes these mast cells, and they tend not to release their histamines, and they tend not to manufacture the histamines as well. So therefore, it can be useful in people that have histamine excess syndromes like mast cell activation. And also it can be used to manage allergies that trigger asthma, especially during asthma season or allergy season, okay? So generally, when I'm using it for a cytokine control in a teen or an adult, I would dose it at 500 milligrams 3 times a day. If you are wanting to do just allergy control, histamine stabilization, I find 500 milligrams 2 times a day works. Okay, so for cytokines, 3 times a day. For histamine control, I like using it twice a day. Okay, all right. Now, the quercetin phytosome that is used in this phytosome product that Thorne has is using fatty substances to increase the quercetin absorption. Another way to increase quercetin absorption is black pepper, can be useful, okay? So anyhow, I think I may have answered your question here. Yeah, so I would dose it. I like the Thorne product. That Thorne quercetin phytosome is a good product. Thorne does a good job of sourcing good ingredients, finding very good active ingredients, and of making sure that they use fillers and things like that are not harmful, okay, or hypoallergenic. And so I like their product. And that for a teen, even if you're talking a 12-year-old teen or a 13-year-old teen, I guess 13-year-old would be a teen, but even the younger teens at 500 milligrams twice a day is what I'd recommend. Okay? All right. Good luck to you, Tammy. All right. Hello, Sarah. Let's see. Are vibration of Lyme disease different from vibration of seizures? So seizures, just to make sure we're on the same page here. So seizures are basically a disorder where you get a lot of electrical firing of nerve signals in the brain that will give you symptoms of shaking, like big arm movements, okay? Or there are big body movements, all right? Or seizures can get, there's a type of seizure called an absence seizure where a person will just kind of look off and stare in the distance and they just kind of lose consciousness for a little bit. So seizures usually are going to be of those two kind of qualities. In terms of feeling vibrations, I wouldn't necessarily classify those as seizures, but I may need to know more of what's happening with you to answer that for sure, okay? And then, I'm sorry, everyone. I'm having my own allergies have acted up here today all of a sudden. Hold on here just a minute. I should be on my own quercetin, I think. But normally they're not all of a sudden something just hit me here. Anyhow, in Lyme disease, one of the co-infections that people get is Bartonella. And Bartonella, I have found in some people gives a symptom that is a feeling of vibrating or buzzing on the inside internally. And it does not produce anything visible, okay? And that is not necessarily a seizure. It's just an electrical activity of the nerves producing that kind of sensation that can occur for people with Bartonella. Okay? All right. Good luck to you, Sarah. Hello, Marshall. Let's see. Hello, Dr. Ross. And thank you for giving so much of your time to questions each week. You're welcome. Let's see. I'm halfway through a 21-day doxycycline prescription for acute Lyme with bullseye rash, 102-degree fever, and headaches, only now starting to subside. How do I know if 21 days is enough versus 30 days? And should I also start taking herbals now to prevent development of the cyst form? Wow. You know, so with a bullseye rash, let's look at this together. I've written an article about this. I usually will look this back up. My tendency with a bullseye rash and the kind of symptoms you've had is to actually go 6 to 8 weeks with the antibiotics. Bear with me here. I'm going to pull up an article. All right, so what to do about an acute tick bite. That's this tab right here. Okay, and these are what my recommendations are. Yeah, here's my recommendation. And this is based on a review of science. So I write, and the position is similar to what some other positions are out there. This is also, I think, the ILAD's position as well, too. If a person has a bullseye rash or symptoms such as increased temperature, flu-like symptoms, or neurologic symptoms, then they should be treated for a minimum of 4 to 6 weeks and reassessed, okay? So I actually tend to go more 6 weeks in situations like this. Let me go back and look at your question again. Okay, so the whole reason to use antibiotics is to prevent from getting chronic Lyme, okay? And there are a number of treatment failures that occur if you don't treat for at least 4 weeks. And because chronic Lyme can be so severe, I push it to at least 6 weeks of antibiotics, okay? So how do I know if 21 days is enough versus 30 days? You don't. And because there's so many treatment failures of treating less than that, most of us that treat Lyme are going to go push it more up to 6 weeks in a situation like this, okay? Should you necessarily do grapefruit seed extract? For acute Lyme, you can figure that probably the immune system is helping you deal with the cyst form of the germ, and it is just doxycycline alone that you need, okay? That tends to be how I handle it in my practice, all right? All right. Good luck to you. Hello, Lisa. Let's see. I'm on 3 weeks of doxy for acute Lyme. Is that long enough? I'm on my 5th day of doxycycline and still feel tired, nauseous, and some anxiety. Is that a concern? I'm also taking a probiotic, red clover, eyebright, and suma. Is that good? Do you recommend anything else? So I'm on 3 weeks of doxy for acute Lyme. That is long enough. I'm on day 5 of doxy and still feel tired, nauseous, and some anxiety. All right. So Lisa, to answer your question, I can't answer it. I don't know enough details here. I don't know whether you had a bullseye rash. I don't know what other symptoms you had right after your tick bite. I would need to know a lot more things. Usually, again, for a tick bite that is symptomatic, I want to treat for 4 to 6 weeks. But to specifically answer your question for your situation, I need more information. Take a look at that tick bite article that I wrote, okay? All right. Good luck to you. Hello, Sam. Hello, Dr. Ross. Are there any herbal options to treat colonized mold in the intestines? Or do you have to use prescription antifungals? Thanks. It's a good question. And I've been wondering that lately myself too. So everyone, with mold toxicity, the majority of people that have too many mold toxins in their bloodstream, all that we have to do is bind those mold toxins out of your intestines, and that will take care of the problem. And it usually takes somewhere from around 3 to 6 months to be able to pull those mold toxins out. But if you're in treatment and you're about 3 to 6 months in and you are not getting better, then it is possible that in addition to having breathed in mold toxins that got stuck in your bloodstream, it is possible that also you got colonized by mold when you lived in your moldy environment, and that some of those mold colonies live up here in your intestines, and they can live down here, here in your intestines and up here in your nose. I don't think your intestines are up here. And so that the issue is that you can start becoming your own mold toxin brew pub, okay? You grow your own stuff and you produce your own toxins. Now, we don't have a good test that says you have mold up here, and we don't have a good test that says you got mold down in your intestines. So we make that determination that you might have mold there based on how do you respond to the binders. And if you've done binders, a good kind of binders for the type of toxins in you for 3 to 6 months, and you're not getting any lowering of your mold toxins, we then surmise, we then think, gosh, you must be producing your own mold toxins, okay? All right, now, I know some of my colleagues automatically, when they see somebody that has mold toxins, also right away put them on antifungal agents to treat for mold. I don't find that's always needed. In fact, I find 90% of the time I never have to put a person with mold toxicity on a mold fungus killer, okay? All right, now, in terms of things that are recommended to kill intestinal fungal infections, they would fall in a family of prescription antibiotics called the azoles, of which fluconazole, itraconazole are some of those. Amphotericin is something that can do it too. But I've recently been thinking, and I haven't done it, I've recently been thinking of trying this herbally. And if I were to look at herbal options, I would be looking at the same things that probably work on yeast, because yeast is actually ultimately a fungi mold, Candida yeast. Probably the same things we use there should work for intestinal mold. Okay, so things like caprylic acid, garlic, the volatile oils like rosemary and thyme. Those things I think are things that should work. Now, I haven't tried it yet, but I've been going to probably be doing that soon with some people that don't want to do the prescriptions. And if I were to do it at this point, I've been thinking I would try a Capri Plus by Karuna, which is caprylic acid, rosemary, and garlic. Give it a try and see. Okay. All right. So those are some thoughts. All right. Good luck to you, Sam. Oh, if I were to do that, 2 pills twice a day, I'd also want to make sure that you're doing probiotics too. Okay. All right. Good luck. Let's see here. Get rid of that. Hello, June. Is the best treatment for burning sensations from Bartonella curcumin? So Bartonella, everyone, can cause a lot of neuropsychiatric effects, okay? So it can affect the nerves. And one of the things it can do when it affects the nerves is injure the nerves, and a symptom of nerve injury can be numbness or it can be nerve pain. Nerve pain has the qualities of sharp, stabbing, burning, or electrical, okay? Those are the types of qualities it can have. So the burning sensations you're having here probably means nerve injury. One part of helping with nerve injury is to decrease the inflammation of that nerve, and the curcumin could help the inflammation part of that. But you also want to repair that nerve injury, and what is good at doing that is glutathione. So I usually will have people be on liposomal glutathione, which is glutathione that's microscopically wrapped in fat to increase its absorption, all right? And what I would do, the product I like for that is a product made by Research Nutritionals, which is called Trifortify. They have a Trifortify watermelon, a Trifortify orange product, and I would do 1 teaspoon 1 time a day. Glutathione does a number of things. Number one, it also helps lower inflammation. Number two, it is an antioxidant that is made in every one of our cells to repair damage from the inside, okay? And so if you've had nerve damage, it may have exhausted its own glutathione gas tank, if you will, and you need to fill that glutathione tank back up again, and that's what the liposomal glutathione will do, all right? And then finally, glutathione also is useful in helping with detoxification as well too, okay? The other thing that can help with the pain, just the pain part, not the inflammation and not the repair part, but can help modulate the nerve transmission of the pain, is to use an herbal medicine called L-theanine, L-theanine. It's a 100 milligram pill. Theanine is a component of green tea. It's not caffeine, but it is a non-caffeinated component of green tea. And inside of the brain, that is converted into a chemical called GABA. Our brain has a bunch of neurologic receptors that are called GABA benzodiazepine receptors. Benzodiazepines would be things like Valium, for instance. Okay, so it's the same spot that Valium binds to. The GABA part of that is the same part that anti-seizure medicines that we use for pain control bind to, like gabapentin and Lyrica bind there too. But natural GABA binds there as well. Okay, so L-theanine is turned into GABA, and if we bind those receptors, it helps lower nerve pain and decreases the nerve pain transmission. So one way to use the GABA would be like 100 milligrams, and you could do one pill 3 times a day. Be aware it may make you a little sleepy as you start it. Try to stay with it for a few days at that dose, and if you tolerate it, you're not getting enough pain control, you could go up to 2 pills 3 times a day. Okay, all right. Anyhow, I hope that gives you some things to look at. All right. And June, thanks for that question. Hello, Lisa. Let's see. I'm on 3 weeks of doxy for acute Lyme. Is that long enough? I'm on my, oops, we already answered that one. Sometimes people write their questions twice. So, and I generally am not really looking these over until I post them on your screen. So, all right, let's see. Hi, June. Does Bartonella and Lyme affect our connective tissue? And if so, how can we protect our tissues? Thanks so much. So Bartonella, which is one of the Lyme co-infections, really makes enzymes that can break down connective tissue. Lyme also makes enzymes that can break down connective tissue. So connective tissue, everyone, is the type of tissues and fibrous material that holds our skin together, holds our organs in place, wraps around our blood vessels to keep them from popping out, and gives our skin its tension so that we don't get a bunch of wrinkles. Yeah, Lyme can cause injury to that. I have not found a good way to protect it. I'm sorry, I don't have a good idea for you there, June. All right. Thanks for your question. Hello, Kate. Let's see. Hi, Dr. Ross. Thanks for hosting. You're welcome. I feel pretty confident that I have cleared Lyme, but I still have mycoplasma. So I'm thinking there's something holding my body back from completely clearing it. I recently tested positive in blood for strongyloides. Do you think the parasite could be holding my body back from finding out mycoplasma? Also, does LDN cause or worsen tinnitus? Thank you. All right. So let's talk about mycoplasma, and then I'll come to the LDN next. So mycoplasma, everyone, is a bacteria that lives inside of your cells. And there is a common kind called Mycoplasma pneumoniae. There's also a kind that's found in ticks called Mycoplasma fermentans. Mycoplasma pneumoniae, which is what I assume you're talking about here, is a common infection that is found in healthy people. All right, it's found in healthy people. So just finding elevated antibodies or evidence that your immune system through an elispot has been fighting mycoplasma does not mean it is causing you a problem. I know a number of my colleagues will treat for mycoplasma, but I have to rely on science that tells us that if you were to pull 100 healthy people off the street, you would find elevated antibodies in these healthy people against some common viruses like the monovirus, like the human herpes virus type 6, like cytomegalovirus. You will also find elevated antibodies against chlamydia pneumoniae and mycoplasma pneumoniae. And these are all common infections that can cohabitate with us. And our immune systems do what they're supposed to do, which is keep them under control. All right. So I actually don't buy the idea that mycoplasma is part of the problem here. And in most of my patients, I don't buy the idea that they have chronic activated viruses. I will also let you know that the things that your doctors did or you did to clear Lyme should have taken care of the mycoplasma too if it was a problem. It should have lowered it back in to the part that the immune system could keep it under control. And so the intracellular antibiotics we use, like clarithromycin, doxycycline, tetracycline, minocycline, azithromycin, Bactrim, all of those, rifampin, all of those treat mycoplasma. So I know that some of my colleagues fixate on mycoplasma. I don't understand why, because it's a common infection. It's just like as common as bacteria living on our skin in some of us, basically. So just finding it there does not mean it's causing a problem. Okay, all right. So number two, in terms of low-dose naltrexone cause or worsen tinnitus. So naltrexone, everyone, is a narcotic blocker, and we have our own internal narcotic system known as endorphins. And those endorphins help regulate pain, but they regulate the immune system. And if you provide a temporary blockage of those endorphin receptors with naltrexone as low-dose naltrexone, it can sometimes help regulate the immune system so it stops attacking you if that's one of the problems you have in your disorder, okay? So that's why it can be used. I'll show you, I'm giving you a really brief synopsis. I'll show you a big article that I've written about it if you want more detail about it too. Anyhow, in terms of side effects that low-dose naltrexone causes, I have not seen it to cause tinnitus, but it sometimes can cause central nervous system symptoms. If it were to cause tinnitus, as you stop it, that symptom should go away, okay? Let me just do a quick screen share here. And I use a lot of it in my practice, but I haven't seen anyone develop tinnitus. And I'm looking at the article I've written about it because in the article I wrote down common side effects, and I don't think it's a common side effect either. So let's see here. I'll look under my immune system chapter here. This is my low-dose naltrexone article. Okay, so side effects are anxiety, drowsiness, headache, insomnia, some muscle pain, vivid dreams, mood changes, and trouble with concentration. Some people get nausea, some people get abdominal pain, diarrhea, and anorexia. But generally, I don't see in this list tinnitus. And I have to say, in my experience, I have not seen it to cause tinnitus either. Okay, all right. Doesn't mean it won't in you, but if it does, just stop it. It's not going to be a permanent injury. None of those side effects that I just listed. Once you stop, if you experience them on low-dose naltrexone and you stop the low-dose naltrexone, those side effects all go away. Okay? All right. Good luck to you. Hello, June. Let's see. What best helps the psych issues that go with Bartonella? So in terms of Bartonella is known, again, for giving a lot of neuropsych. And so you can get bad anxiety, bad depression, you can have hallucinations. And so one of the things to do is kill the germ, okay? So you've got to do things to kill the germ. But in addition, sometimes you need to use psychiatric medications. And that which ones you use depends on what your major problem is. So if you've got OCD as part of this, then you've got to use anti-OCD medicines. If you are having hallucinations, then you need to use antipsychotics. So it all depends on what the underlying issue is, okay? All right. Thanks for the question, June. Hello, Carol. Let's see, what do you think about medicinal cannabis for chronic pain? So I think for some people with chronic pain, medical marijuana as either high THC products or CBD products can be useful for chronic pain. The only way to know if it's useful is to try it, okay? So in terms of medical marijuana, something that has more than 0.03% THC is classified as marijuana. Products that have less than 0.03% THC are classified as non-marijuana and therefore can be sold unrestricted. Most of those are CBD products. So CBD is an oil that is also found within cannabis plants, okay? So what is regulated is things above 0.03% THC. Those are called marijuana. Things that have less than 0.03% THC are non-marijuana products, of which the predominant one out there is CBD. Okay. Now, the way that this works is we have in our own bodies, we have a natural, I'll call it a natural marijuana system, which is actually called the endocannabinoid system. All right. And the endocannabinoid system has various receptors, of which THC binds to, I think, the receptor number 2, if you want to call it that, okay? The way that CBD works is CBD doesn't appear to bind directly to any of the receptors, but what it does is it prevents the normal endocannabinoid chemicals that we make in our bodies to not be broken down, so that we have higher elevated natural chemicals, endocannabinoid chemicals in our body to regulate these receptors. In terms of things to think about the difference between THC, high THC products, and CBD, THC is what gives you the high. It also can tend to be the thing that makes you drowsy, okay? And so I tend more to reserve those for the nighttime. And then I tend to use CBD more in the daytime because it tends to be more of an upping than a downing chemical compared to THC. Having said that, when you look at pain control, often THC products have better pain control than CBD. But that doesn't mean CBD won't work in you. And the only way to know if it does is to give it a try, okay? In states that have medical marijuana laws, if you go, you can often go to the store and talk to your budmaster about which products they have. They can tell you which of their products is higher in THC and has just a little CBD, or they can tell you which of their products are predominantly CBD with a little bit of THC. And you can play around with different blends of those to see which one works best for you and which one, especially in daytime use, does not give you a lot of hangover. Okay. All right. I have a whole article I've written about this, which gives you a lot more detail. Let me go ahead and show that to you. All right, so this is my medical marijuana, cannabis, and CBD for Lyme article. And believe it or not, I'm going to look down here and just see what that percentage is, because I think, it's 0.3% THC. So products that are above 0.3% THC are technically marijuana, and they're regulated. Anything that has less than 0.3% THC is not considered to be marijuana and is able to be sold as a CBD type product. Okay. All right. There you go. All right. That's it, everyone. The Basenjis, my 2 dogs, are here with me, and they're starting to rattle under the table here, ready to get out for a walk. They want to take me out. I like it when they take me for a walk. And so I'm going to go do that here. And so look out in your email tomorrow morning, somewhere between 9:30 a.m. in the morning. I plan to have the edited version of the video ready, and I'll send you an email announcing it's ready. And in that email will be a link that you can sign up for the next series of webinars that will be 2 weeks from tonight will be when we do this again. If you are finding value in this, please share it with other people you think might get benefit. You can share it by sharing the email when I send it tomorrow morning. Okay, feel free to share that to anyone. Also, feel free to share the announcements of the next webinar when I send those out to other people as well too. My goal is to help as many people as possible, and you can help me reach those people. All right. So good to be with you here tonight. I hope you all found some value out of this and got benefit. And I look forward to seeing you in a couple weeks. Okay. Good night, everyone.